everyone. Welcome to the Imperial College Global Masters of Public Health webinar to talk about our admissions process. So first thing we're going to do is we'll go around and just introduce ourselves. So my name is Catherine Collett, and I'm the Senior Teaching Fellow on the Global Masters in Public Health. What that means is that I'm helping design and develop the course, but I'm also teaching on a number of modules. And then we'll start over here. Anna, can you introduce yourself?
Hello, I'm Anna Shaida. I'm an online coordinator for the program.
Hello, I'm Hayley Atkinson and I'm Education Manager for the School of Public Health.
Hi, I'm Richard Pindra. I'm the Specialisation Lead for Foundations in Public Health Practice.
Hi, I'm Pat Singadino. I'm the Online Administrator for the Global Master.
Thanks very much, everyone. So the first thing we're going to do, hopefully you guys can still see our screen. So do send in a text if you can't see the screen share. And hopefully you can also hear us. So do send in a chat if you can't. So the first thing we're going to do is just go through a bit of housekeeping. So in terms of what we're going to go through today, I'm going to talk a little bit about the overview of the GMPH program, the Global Masters in Public Health, and the delivery and student experience. Hayley's then going to talk a little bit about admissions, and Richard is going to then talk about his specialization, Foundations in Public Health Practice, and what's going on there this term. And then we'll have ample time for some questions and answers. So you will see a Q&A function down here at the bottom of your screen. And if you do have questions as we move along, our team is going to be answering those. So please do use the Q&A function. It allows us to look through the messages and make sure that we are getting to what you're saying, because there can be a lot going on in the chat feature. So please do that. When we get to the question and answer portion of this, we can do that via text. And I think today we're going to probably, given the number of folks that are on the call, not actually do audio. But if you do really have a question that you need to ask out loud, you can send that in the text, and we can see if we can open that up as well. So when you do click the question and answer feature, it'll pop up just like this on your screen, and you'll be able to type in. Right. So getting down to business, what is the Global Master in Public Health at Imperial College? So first we're going to start with a course overview. Essentially what we've got is a 2-year part-time program. And over the course of this program, you take a number of core modules, and you can see those there in green, as well as a number of elective modules. And the third component is a 4-term research portfolio, which ends in the 4th term with you actually completing a research project of your choosing, either on secondary research data analysis, on qualitative or quantitative methods. So you'll see in the 1st term, we start with statistics for public health, epidemiology for public health, and foundations for public health practice. Those are what we feel are our very core modules. And that's what sets you up really to be successful in the program moving on. So we're seeing that people are having a bit of trouble hearing us. So if you can just slide, yeah. Hopefully this is a bit better and it's picking up our voices a bit more. We're in a Zoom room here, and I know sometimes it can be a bit quiet. So hopefully this is helping things. Sure, yeah, that'd be great.
Okay, I think some of you can hear better now.
Great.
I think we'd also encourage you to check the audio settings as well on your laptop. Make sure optimum is headphones and that you've got your volume turned up as well. That would be great.
Fantastic, thanks very much. Okay, so back to our program as a whole. So we start with these 3 core courses, which we feel like really set students up to be successful in a master's program and in this global online master's in public health. After that, you have an option of choosing, so we have the core courses, as you can see in green along the top there, just here. And those courses give you a really, I think, strong foundation in the different kinds of topics that you might have moving forward in public health, as you might apply yourself in any job. We also have these elective courses, which we do have a mix and a split between courses that have a more quantitative focus or more data focus, and those that have maybe a more social science or kind of applied public health focus. You can see that here between global health innovations, which really is looking at different types of new tools that you might see in different countries, how we might have forward or reverse innovation. So really topical and kind of exciting ideas. And infectious diseases modeling here, you'll be using R to model how an outbreak might happen in various different situations. As I mentioned very briefly, we have our research portfolio as well. So we take students all the way through designing your research question to the study methods that you might use, both kind of if you were going to do research in the future, but also in your own project, through ethics and those types of considerations around actually conducting a research project. And in the end, you get to choose your own research project, and you get to do that over the course of one full term. And that's our capstone dissertation project. So as I said, basically three courses per term over the 2-year program, which is part-time. So what does the student progression funnel look like? So we start with an application, and you might find us from various different avenues. So the Imperial website, our open course specialization work. You might also find us on the Coursera website as well. You put in your application, and if you are successful, you'll be made an offer. After that, we hope that you accept the offer. And then you go into an onboarding course. This really provides you a lot of information about what we have to offer here at Imperial College and what you have to offer as an online student, and gets you ready to start your courses. And then after this whole process, you go into term 1, and you get to then go through Foundations in Public Health Practice, Statistics, and Epidemiology, and then choose your courses moving forward. So then another question that often we get asked is around our assessments. So you've now heard about the courses, you've heard about how you get in the program. What is it that you do? So you work your way through a number of formative and summative assessments throughout the process so that it helps you kind of solidify your learning. But you also work through the course content, which includes activities, which have various different things, discussion forums, videos, all sorts of those things. And ultimately, your summative assessments are what do count for your grade here at Imperial. And we've got a number of different ways that you can you do this: peer reviews, written essays, data set analysis. And essentially, what we're trying to do is that we link our learning objectives in the courses, designing theory and practice, and how to apply that in actually our assessments as you move forward. So Richard will talk a bit more about his, so I'll leave that there for now. And the methods of assessments will vary throughout the program, and I think it'll really build your skills as a public health professional moving forward. The other thing that we have, in addition to the course content on Coursera, you might have seen it before, but in addition to that, we build an online community. I think this is a really important point and a really important difference, I think, to our program as to some other programs. So we do live sessions once a week or once every other week, as well as open office hours to send in your text and your questions live. And this really is helpful, I think, for students to engage with one another, as well as engage with the content and the teachers that we have here at Imperial. I know it's something that's been really nice for me to see students on the screen, get to know them, and really see what's going on. We also have a personal tutor system, which again provides you another opportunity to synchronously talk to folks here, discuss maybe any concerns you might have over moving back into academia if you've been out for a while, or learning about the course content, about the services we offer here. And we've got an open support line that you can type your messages in if you've got any technical problems or actually any queries about the program as a whole. So we feel like we're building the online community with the Zoom and with other kind of methods. And we feel like it's really important to make sure that you guys feel very, very comfortable with us as a teaching staff, as well as a program support team, and for you to feel like you're really engaging in a way that's meaningful to you. So a quote that we've got is often called distance learning, but I think it's quite a misnomer. In an online environment, the learners are right there in front of you, and so what you can see is just a really nice picture of everyone chatting away, learning together, and so that's the community that we're trying to build. If this sounds like it might be interesting and something that you might be willing or excited to engage in, then we suggest that you go through the admission process. And so now I'm going to turn it over to Haley, who's going to talk to you a little bit about what the admissions process is, how it works, and what we're looking for in applications, because that's a really important point in making sure that you can get into the program.
Thank you, Kat. So a number of you are submitting questions about entry requirements for the programme. So we really encourage you to visit the webpage if you haven't already done so. And I've shared the link to that. It does detail exactly what academic entry requirements we're looking for. There is also a lot of information on the Imperial College web pages. So once you visit our course webpage, you can follow through if you're unsure if your overseas qualification would be valid. There's an awful lot of guidance. You can also reach out to us individually via gmph-queries@imperial.ac.uk as well. If you have any kind of specific questions about your application in particular or your qualifications. As I mentioned, the entry requirements are listed on the webpage. And just as a high level, because this is a master's degree, our minimum requirement is a 2-1 degree in a science subject or an MBBS medical degree. Suitable applicants are likely to be those with a background in medicine, health services, biological sciences, or environmental sciences. And also mature applicants with relevant academic or professional experience will also be considered as well. So if you want to find out in particular about your specific qualification from your country, we advise you to go onto the Imperial College web pages, because you can find out that information yourself. However, please do contact us if you're unsure and you want to double check before you apply as well. So as I said, there's an awful lot of information on the web pages. In terms of how we process admissions, so we're currently recruiting for entry to the programme next year. So the programme will start at the end of September 2020. The number of places that we have available for next year's entry, it's a growing cohort. So we started with our first cohort this year, and we have 70 students currently on the programme, and that will grow next year. However, the programme is highly competitive. So what we really do encourage you to do is to, if you're interested in the programme, is to apply sooner rather than later. And what that means is that it will ensure that your application is reviewed and you're likely to get a decision on your application within 6 to 8 weeks. There may be instances where this is quicker, or it might take slightly longer, but just to give you a rough idea, if you apply now, then we'd aim to get back to you kind of in the new year. So that's why we encourage you to apply as soon as possible, because places do fill up, and we do already have a couple of hundred applications that have come through to us, just to give you an idea of how popular the programme is. Each application is considered by the GMPH team, and that includes Kat, a senior teaching fellow. The people that will be teaching and engaging with you on the programme will be assessing your application. And I think that's a really important part of the process. So they really do get to know you before you may potentially join us as a student. They will look at your application. They'll not just look at your qualifications, but they look at your experience, and that really is quite a broad, could be a broad range of experience, from your work experience, it might be research experience, it might be volunteering experience, it might be experience in the field if you currently already work within public health or a related sector. So we really encourage you to talk about you and yourself in your personal statement. And that's a really key part, and I would say it's probably the most important part of your application, so that you can really express who you are to the team in your application. And what's really important if you decide to apply for this programme is why the Global Master of Public Health at Imperial College. What is it that you're drawn to? and how does it fit in your kind of career right now or your life right now, and how do you think you would apply it to your experience and what you hope to gain in the future as well. So we really encourage you to take your time and write that personal statement with some care and some love and some attention, because that will really make you stand out when the team review your application. Because as you can imagine, we receive thousands of applications, and that's certainly not to put you off. We really do want you to apply, but we just want to encourage you to really think about your personal statement, so that when the team come to review it, they really get a flavour of who you are and why you might want to join the GmbH. In terms of deadlines, what the reviewers are looking for, so this kind of touches on what I've already spoken about, but they really want to know about your interests. So again, who you are as an individual and where you think the programme might take you for your future. And I think it's perfectly fine if you're not 100% sure about that just yet, but you might have an idea, you might have ambitions. And I think it's absolutely right that you would talk about that and express that in your application. As mentioned, we want to get an idea of where you've been professionally in your work career, but it really might be other experience. If you're coming immediately from undergraduate kind of education, please do talk about that as well. You might have done volunteering, you might have interest. There really might be a broad range of experience. It's not just about your professional kind of work life. And really, again, as I mentioned, why this programme? So we really encourage you to spend time looking at the webpage, looking at the information available, and please do go onto the Coursera web pages as well. And Kat and Richard will touch on this later, but there is already some open content available to you via Coursera. So you can begin to understand what taking the degree programme may be like for you, whilst the degree programme is different to the open content. It will give you a flavour of what to expect from being an online learner, which is really important for this programme because it's not an on-campus attended programme. So you might want to just consider those things and refer to that in your application as well.
These are the useful links, as we mentioned, so you can go onto the Imperial webpage. The frequently asked questions on the Coursera webpage is also really important.
Yeah. And I just, because I see there's a question about financial aid, and I think this is a common query, and financing your degree is a commitment. So we do encourage you to think about how you would finance the degree. The School of Public Health do offer a range of scholarships, and for this programme there will be a couple of scholarships available. They are fully funded in that they pay for the tuition fees, and we will circulate information about this in the coming months. So I would encourage you again to apply as soon as possible. We start to review applications for scholarships in around May. So again, I think as a really hard deadline, we ask you to make sure that you get your application in as soon as possible and no later than the end of May. And please do keep an eye out on the School of Public Health web pages. There is already a scholarships web page there where you can get a bit of information, but we will be updating that in terms of deadlines and the exact steps. And to answer the question, do scholarships require separate applications? Yes, they do. So the scholarships, you will have to make an application to the programme separately, and then if you are interested in being considered for a scholarship, you will need to submit a separate application for that. Some of the information you will be able to simply copy from your programme application. So it's not a complete duplication, but it is a separate one.
Yeah, I think that's really helpful to say. And I would say, in addition, if you're, depending on what country you're living in, if there's a bursary program, if there's other scholarships available to you, we would really strongly recommend that you look into those early, because as we did say, there are limited scholarships available for students. There were a couple of questions just before we move on to Richard. There were a couple of questions around what kind of certificate you got in this program and when how it was valid and how it's awarded. And so I'll just touch on that really quickly because I know that's a common query. It is something, if you do want to look at our frequently asked questions, that is included on there as well, so you can get more information. But essentially, this is a fully online program. However, the certificate you receive is a global master's in public health. At no place or no time does it say it was an online program. It is the same quality, the same caliber as our on-campus program, and so we wouldn't expect that, that there's any difference there. Obviously, the mechanisms by which you learn are different, and I think actually, our students on the program now are really engaging with one another, and we're really finding that exciting. And Richard will talk about that more. The other thing, so the certificate, we do not here at Imperial, our program is not accredited through a specific system in the UK. And therefore, it doesn't necessarily map on to exactly what is in every single country. However, it is a very highly regarded degree, and if you were going to take it somewhere else, people would recognize it, and I don't think that you'd necessarily have a problem. But the accreditation system is very different in all of the different countries, and so that just know that from our side, it isn't an accredited degree, but that's okay. You should still be fine to use it, and people do recognize it, absolutely. So that kind of squares that away. I'm going to now turn it over to Richard, who's going to chat a little bit about FPHP, one of our wonderful programs.
Well, thank you very much, Kat, and welcome to all of you, wherever you are in the world this afternoon. It's really exciting to see this part of the process, because we've been working on this degree, developing it for the last year and a half. And it's been so exciting over these last 5 weeks to have actually had the students sort of come in and for us to actually be doing the teaching. So this comes at a good time. If we go to the first slide, Kat. So my name is Richard Pender. I'm a public health doctor and I'm a consultant in this country. So that means for those of you who are perhaps from the US background, I'm an attending in public health medicine. And my role here is to try and, well, not to try, but to deliver a module which looks at the practical side of public health. So when people ask me what does a good MPH look like, or what does a good student look like from a good MPH, similar to that sort of certification question we were looking at earlier, Kat, is I always ask the question, well, how would they do on their first day in public health practice if they were working for me? And that is very much the sort of the perspective that we've come to FPHP, Foundations of Public Health Practice specialisation from. And our job is to get you prepared for your first day in your new public health role at the end of the programme. And that is irrespective of whether you want to work in academic practice, in clinical practice and go back to seeing patients, or if you want to work in the sort of broader public health practice in NGOs, in government organisations and so on. And we'll be covering all of that over the 16 weeks of Foundations of Public Health Practice. And that question, I think, that came up earlier on, which was asking, is this a research-oriented programme? Well, we're very good at research here at Imperial College London, and that is definitely one of our strengths. But we need to prepare people for all sorts of different backgrounds. So although we will get you very strong on research, we will also get you very strong in those other two domains as well. So let's move on to the next slide. What is Foundations of Public Health Practice? And some of you will be coming to us, as they have done this year, with deep backgrounds in public health, where you're wanting to sort of formalise your practical experience. There are other people who are coming to this programme with very little sort of experience in public health, and some of you might still have at the back of your minds, what is public health? Well, Foundations of Public Health Practice is designed to make you feel comfortable and to give you that frame of reference to be able to look and analyse and respond to public health challenges as an expert. And it's also really important to make you guys effective in whatever form of practice you decide to go into. So we have 16 weeks of the FPHP programme, and within that we have 5 courses, as we call them. And these are, as you can see on the slide, the public health approach, the public health toolkit, behaviour and behaviour change, an introduction to health protection, and the emerging public health professional. And actually that last course for me, Kat, is possibly the most important out of all of them, because what it does is it brings you into our public health family. And such an important part of working in public health is that we are part of this worldwide global profession. And it's my job to very much make you begin to feel that in your first term on the GMPH, and certainly by the end of the 2 years, I will measure our success on this programme by how many of you feel part of this global community. So looking at some of the sort of topics that we've got on there, we start off on that first course looking into the history, the background of public health, and really trying to pick apart the core principles, whether that's inequalities, whether it's to do with public health ethics, and really trying to take apart those concepts that you'll be very familiar with, such as prevention, early identification, and so on. The second course, the Public Health Toolkit, it's a slightly funny title, but we spent a long time trying to come up with a good title for that one. But this is really what we spend our lives doing in public health practice. So thinking about those analytical skills. And the great thing about Imperial graduates, and I've employed quite a few Imperial graduates now, the great thing about all Imperial MPH graduates is that you guys are fantastic quantitatively and analytically at the end. And so what we're doing in that second course, the Public Health Toolkit, is really trying to give you, to build on the complementary courses on epidemiology and statistics, really build that practical, pragmatic, practicable approach to analysis and understanding that we live in this imperfect world with imperfect data, and how you can exercise your professional judgment using what we call health intelligence, looking at demographic data, routinely collected health statistics, and so on and so forth. And actually, that's one of my favourite parts of the course, because like I said, our graduates are fantastic at that. The next course, Behaviour and Behaviour Change, Kat is our featured sort of guest lead for that course. Kat, you've spent many months working on that, but a lot of you will be familiar that that a lot of the time what we're trying to do is we're trying to effect behaviour change. And whilst historically that has been very much trying to think about individual people and think about how can we motivate someone to perhaps not smoke or to eat more healthily, we're going to take a much broader perspective on behaviour change in our course. And our job is to think about, well, okay, from a government point of view, not just at that clinical level, from a government point of view, what are the consequences of taxation, of legislation, policy changes, all the way down to that individual level of thinking about individual patients, how can they improve their behaviours. Our fourth course is health protection, and this really, really motivates a lot of our students. And this is the model of FPHP is actually based on our on-campus programme. This is one of the highlights I know for a lot of our students, where we begin to think about this concept of health protection, which sort of ranges from this incident management of some, for example, a restaurant that has had a food poisoning case, all the way up to what we call CBRN, chemical, biological, radiological, nuclear, threat management, and sort of strategic health protection responses. So that takes us to week 12. And at that point, we then move into the emerging public health professional. And this is all about those sort of softer, more challenging skills that I think, particularly as scientists, we sometimes struggle with in public health. We spend a lot of time being scientists trying to think that we're right. And sometimes being right in public health is helpful, but it doesn't actually make you effective. And so that final course is around trying to develop those skills around how you engage with other people, how you communicate, how you influence, and how you actually affect that policy, that change to improve population health outcomes. So that's what we're going to be doing in that final course. So how are you going to be learning? Well, of course, it's no secret that this is entirely online, and we've sort of got the stuff that's on there on Coursera, which you can do in your own time and has that flexibility and the opportunity to go at your own pace. But we also have the synchronous, what do we call them? Live sessions. There's been a few names. Live sessions is what we call them. We have ours on a Monday, and that's a great opportunity, actually, even just from the teacher's side, for us to meet you guys and see you guys interacting. And we've been so impressed these last few weeks about the level and the sophistication of the discussions that have been going on between yourselves, actually. And it's really interesting comparing this group to what we see on campus and in the real world, because there's a hugely rich vein of experience that runs through our cohort here. So just in terms of looking at the slide, I'll sort of draw your attention to the big red circle up there. Of course, there is a huge amount of professional knowledge that you will have to cover, and you'll have to be at your fingertips in public health practice. But as we've seen the internet move in and the ability to kind of look things up very quickly, increasingly important is this value of professional skills and this idea of professional identity. And so much of what we're going to be covering is actually going to be moving into that skills area. I think responding to someone who asked a question earlier on, to really think about how we can cultivate those skills and make you competent on that first day in the job. And while we've got core content delivered by practitioners, and we have interviews with our colleagues Talia, Carolyn, and so on, who are recent graduates, and we talk about what their experiences are working in public health settings. We then have online activities and peer reviews, and all of those through this really, really real world practical perspective. And then we also really like to use those synchronous learning sessions, those live sessions. So we think about the implementation challenges and the stuff that's actually really difficult to communicate in sort of a one-way video. That ability to discuss and to debate is a really important part of the concepts that we're covering. So how will you be assessed? Well, I suspect this is going to be a world away right now to those of you, but I'll say very briefly, there's a range of formative assessments which allow you to pace yourself and test your own knowledge as you're going through. We then have a series of multiple choice question tests. There's a short written assignment, 1,500 words I think is fairly short, but you may not think that necessarily at this stage. And then we have a group task and a presentation. And the really important part of that group task and presentation is that so much of our public health practice is working with other people. And if you don't learn how to work with other people, you actually will struggle to be effective in public health. So that's our assessment. So here's the team. Although I'm speaking to you today, and we've got Kat here, we've got part of the FPHP team in the room today. There is actually a wide range of people that we've been working with, and a fantastic team who have both a depth of understanding in real world public health as well as academia and research, but also a real diversity, I think, where our strength is around levels of experience and perspectives. And some of the interviews that we've got in there with some of our colleagues thinking about their first days in public health and them giving you their tips on how to be effective, what they've learned in their first 2, 3, 4 years in the job. There's some really unique stuff in there which I think is really powerful.
Thanks very much, Richard. I think this is a really great overview, and as we were kind of quickly running through all of the courses, what's about, what you might get to see on the platform and whatnot, this really gives you a depth and richness into actually what you might experience if you do join our course, if you're excited about it, if you apply. So thanks very much for that.
And the great thing, Kat, is that we've just announced in the date that we will be launching our MOOCs. So this is a massive online open courses on the 2nd of December. We've just agreed that this morning. So I'm really looking forward that if people are interested in finding out what the course is like, some of those courses, not all of them because some of them are degree only, but some of those courses will be available on the 2nd of December. Absolutely, and I think that brings up a really important point. So our ethos here at Imperial in terms of delivering this content is we do want it to be widely available, open, so that students can learn from around the world if the degree program is perhaps not right for you or not where you're at in your career or your work just now. But that we really do bring in quite a lot more content as well as these live sessions to add to that experience for those students that are here on campus with us. And so I think that's a really important thing to point out. It gives you an opportunity to sort of test out, as we said, our courses. We've got stats and epi are live just now, and you can do a teaser or taster of those, and then obviously FPHP is coming out very soon. And I think it just provides an opportunity for you all to see if this is right for you. Those, of course, are your standard kind of courses on the degree or on the Coursera platform. So they're open content, and they're not, they build a foundational knowledge. You can get a certificate for those, but it's really not to the level that we would expect of a degree student. And so, when we do say that you'll have a flexible learning, that's very true. You can move through the course at your own pace, but it's not maximum flexibility. There are still assessments that come in, and as Richard mentioned, some of those are quiz format, some of those are papers that are then marked by our team here that provide really good in-depth analysis of what you've done so that you can apply that as you move forward, whether you become a researcher, as Richard said, or someone who's working in a local public health council. And I'm really pleased with the assessments that we've designed within this, because I think they're actually real world scenarios. So whereas before on a lot of other programs, there is this sort of artificial, you do sort of a critical appraisal that then sort of goes into the ether. We've really focused the assessment here so that it's meaningful and it prepares you as part of that assessment. It's not just testing you, it's developing you too.
Absolutely, and I think our entire academic team has done a really good job of also thinking through how this course coordinates with the other courses that are going to come up. So Foundations in Public Health Practice, as the name rightly says, is the foundation. How do you build on that in population health improvement and health systems strengthening and all of the other courses that are upcoming? And so our team is really thinking those things through, and I think you'll get a very rounded experience. So by the time you're ready to start thinking about that research question, you kind of know what your area of interest might be and have some really good foundational skills to say, this is what I want to look at and why. So I think now we'll open it up for some questions.
Yeah.
So if you want to kind of keep typing those in, my colleagues Paxton and Anna and Haley, I'll shoot them our way and we can see them on the screen here. So we'll just have a go at answering them.
Great. So it's been great that you've been submitting lots of questions, and we've hopefully been addressing quite a lot of them whilst Richard and Kat have been talking. Just to reassure you, any questions that we don't immediately get to today, we will be providing an FAQ of this live session, and that will be circulated afterwards as well. I have a couple of questions to put to you both. So there's a question about the master's programme. Is it more orientated towards research? So it's really about regarding opportunities after completion and skills alignment as well.
Yes, I think that's a really interesting question, and maybe I can start and you can pick up, Richard. I think there is, as you rightly see in that nice diagram, I can go back to it really quickly, of our program. There is a big research component. You can see lots of purple there on your screen. And I think this is really important for us as an institution to feel like you are coming out of this master's with the core skills you need to conduct research. But that being said, and this is really the reason we take so much time to walk you through that, is because we really want you to understand the core questions about designing a research study, about the methodology, and then give you a lot of time to carry it out. And that's why that final term is fully about you conducting this research, which can be secondary analysis, a literature review, all the way to actually designing a survey and carrying it out. So it's a really important point and component of the program. But equally as important are the skills that you learn in Foundations in Public Health Practice and other courses about being a public health professional and what that means, as well as the foundational theoretical skills that you need and the methodology to be a good public health professional. So I think they all work together very nicely. I think they give you an opportunity to kind of use the skills that you have in data, which you actually might apply when you do, an audit or a health needs assessment. Those skills are important even if you don't become a researcher. That would be my kind of take on things.
Yeah, absolutely. I mean, I think we're really fortunate in terms of the history of what we've had on the MPH here. It has been very strong on research, which reflects the organisation. But those skills that you learn through doing that research are absolutely critical to everything else you do. Until you're doing research, it's much more difficult for you to begin to understand and unpick a paper, because doing the research gives you that ability to then think critically about what you're doing. And this all sort of adds together into making you an Imperial MPH graduate. So yes, we're really strong on research. The programme is strong on research, but actually we're pretty strong on some other stuff too.
Yeah, absolutely. And I would just say as well, the research project itself, you can take a wide range of approaches. So if you're really policy oriented, that's what drives you, that's what you're super excited about, you could do a policy analysis and write a paper that's more kind of policy oriented. It still needs to have that methodological rigor to it, but that actually is really looking at how do I change tobacco policy in the country that I live in.
Yeah. And we have really, really detailed stuff, which is kind of statistical modelling type stuff, all the way through to that policy. So it's a huge spectrum. So what I would advise you is when you see that word research, it means many, many different things. But the consistent part of it is that it's robust, it's rigorous, and whatever you do at the end of it is going to be on quality.
Absolutely.
Okay, great. Thank you very much. We've got a lot of queries, I think, from people who are coming from a certain background with certain types of qualifications. So some have mentioned they currently work in pharma industry. Some are mentioning that they've got a qualification in undergraduate and life sciences. So I think it's maybe just talking about that we do really encourage applications from quite a wide range of applicants. That'd be great just to talk about that.
Yeah, sure. No, I think we absolutely do. In the class that we have now, we have folks ranging from doctors all the way to people who are in finance and might have been working either peripherally or not at all with public health and say, you know, actually what I really want to do, this gets me up in the morning and I want to do a degree course in it. So we've got a really wide range of folks that have just a bachelor's degree and folks that already have a PhD but are looking for more practical skills. So there is a really wide range there. I have to say, I myself am not a clinician. I'm a pure public health professional, as it were. And I did a master's in public health as well. And so what I've been doing is really working around program design, program and implementation, research, monitoring, and evaluation. And I come to my degree from a policy, philosophy, and then a bit of sciences in my undergraduate degree background. And I'm from the US, so we have a bit more flexibility than some other countries to dabble in different subjects in our undergrad. But so for me, I'm not a clinician. I don't come to things from a hard sciences background, but I think I'm managing to be here on the program and a good public health professional. So yeah.
So yeah, I mean, I think the strength of public health is that we are so interdisciplinary. And you know, the one thing, if I'm being totally honest with you guys, I was slightly nervous when we said we were going to go into this online area, because for me, one of the real strengths of a master's degree is that connection, is the linkage and the learning that you get from the other students. But I think what I've been so impressed with through Slack and through Zoom and technology is that actually we have been able to kind of capture that and get people engaging and working together. So I would strongly encourage you, from whatever background you're coming from, you make the course richer and you'll get a lot out of it. I've worked in the pharmaceutical sector as well for a couple of years, and I know certainly a lot of the skills that I learned in that time and working in management consulting, bringing into public health is really, really useful. And I do like to hire, if I've got a kind of like a perfect public health practitioner person in my mind, I do like people who've got a bit of private sector experience or management consulting experience, who are then sort of passionately committing to sort of changing the world. They come into public health and actually they can do some really impressive stuff. It's not just doctors, although I am a clinician, but clearly not a pure public health person compared to how Kat defines it.
I mean, to be fair, you have been doing lots of public health, but I've got to say, not a clinician. That interplay, isn't it?
Right, thank you so much. So I think the key message, it sounds like, is if you're coming from a background that has not been strictly public health or linked to public health or linked to medicine, please do not be put off. And I think it comes down to the application and really articulating why now, why public health now, and why this program now.
Absolutely.
Yeah, okay, fantastic. So there's a couple of questions just about flexibility.
Yeah.
And I think this is a really important area. So kind of the balance of doing an online program, and this program in particular, and balancing that with commitments, what our expectations are for that. So could you talk a bit about that?
Yeah, so I think it is, again, really important to mention this is a master's program. And in that way, although it's online, although it is part-time, there are certain milestones, deliverables, times that you need to do different things. Yeah. And we do follow a term schedule in that way. So I think it's really important to remember that. And if that is the right thing for you, you need to kind of figure that out for yourself. But that being said, it is a part-time program. So we do expect it's roughly about 20 hours a week of study across your 3 specializations during that term. Obviously, there's going to be peaks and troughs in that. When you've got an assessment coming up, you might need to spend a little bit more time. When you don't, you might have a little bit more time. You're going to have to figure out how to sort of manage the different courses that are running simultaneously. Yeah. And I think I'd have to say as well, not every term is exactly the same. So, there's differences. Maybe you have a really strong statistical background, and that means the first term is quite easy for you but you're really, putting lots of time and effort into FPHP because it's different for you. So there is a balance there as you move through the different courses. So I think that's really important. Some of the courses are designed to be a bit more reflective, and I think that's very true of the research portfolio because you're really starting to build your own project. But that does take a lot of time kind of on your own time, even if the course content isn't there on the platform. So I'd say it's very doable, but it's something you've got to think about in terms of how do you schedule your time. even if you're not doing it, 2 hours a day, do you have some chunks where you can sit down and really, really think about that? And that's something that's always on our mind as well, to make sure that we've done the right thing in building this course.
Yeah.
So we are always reevaluating, listening to student feedback, and also around our assessments, reevaluating kind of how they flow, to make sure that we are acknowledging that this is not the only thing that's going on in folks' lives.
Yeah, absolutely.
There's a lot of other important stuff.
Yeah. So it's really about encouraging people to kind of recognise it is a commitment. However, they can balance, depending on their style as a learner, they may approach that in different ways and can balance that around their jobs week to week. Yeah, fantastic. So another interesting question is in relation to so this may make more sense to you. If I'm a service designer working on public health services, is it possible to apply?
Whereabouts in the world? I mean, yeah, I think the answer would certainly be yes, but I'm just intrigued by the question, really, more than anything else. But whereabouts in the world are you based?
I'm not sure. It was from Fernanda, if she's still with us. Maybe if you pop where you are in the chat, and then we can pick up on that question.
The one thing that I would say, which I think is just to be really, really clear, is that public health, for those of you who are not familiar with the topic, is about a lot more than just health systems. Now, the strength of that is that we know that about 15 to 25% of the population's health is derived from the healthcare service. Lots of other things, whether it's the built environment, whether it's to do with socioeconomic media, all of those sorts of things contribute. So this is actually really, really useful for people who come with that sort of health systems perspective. But just be aware, you're going to be learning a lot more than just health systems. But at the same time, you will also be learning about health systems within the module, which it's Sondus's. Where is that?
Health systems development, which is actually in term 2. So that's really, again, looking at the different systems, thinking about how they work in different countries. I think the other thing I would say, just to add to that, is just as Richard said, public health is very broad. So maybe you are working in housing at the moment, and that does have a health implication. So it's very hard sometimes to parse out exactly where public health sits. Or let's say that you are, you're working for a big company that's in a specific area and has lots of migrant workers that come there. And so actually you're providing lots of services. So you're thinking about what services should you provide to the folks coming in when you're maybe not a public health or a health body at all. So I think there is definitely that interplay.
And I've worked in sort of local government, I worked in central government. And the one theme that constantly comes to me is people doing their job for quite a few years and then realising gradually over that time that actually their job, whether it is in housing or in finance, has an effect on health. And then at that point in their career, they sort of decide, actually health is now what I want to focus on. So you sort of shift, you move sideways. And that's actually a huge part of public health. But yeah, my special interest is actually in health systems and health systems development. It's so important to be thinking beyond your natural area, and that's what a public health degree, a public health master's gives you.
Yeah, absolutely.
Fantastic. So we've got some questions. It links to kind of the study, the online nature of the programme. So we've got some queries about assessment. And if there's any on-site exams or seminars, etc. And this is absolutely a fully online programme. So there's no requirements for attendance whatsoever in terms of visiting London or visiting a campus. So did you want to talk about the assessments and what they're kind of like for an online programme?
Yeah, so, and Richard, jump in here as well since you're running the course. As we kind of briefly discussed, there's a wide range of assessments that we have. So we're both trying to test your public health practice skills, but also give you an opportunity to really start to try some of this stuff out. So you might do, like you would in an on-campus course, present a presentation live. It would be via Zoom, but you're in a room just like us, chatting away, having your slides going. And I think that's a really important skill, but you also might upload that presentation in advance and have a voiceover perhaps. I think these are, so we've got many different modes. There are some also auto-marked quizzes. And basically you go in, you take those, it's sort of like a SAT exam here on campus, but then you get your scores sort of right away and you get some good feedback on what you've done well or not. So I think in that way you might compare it to an open contents MOOC or to maybe, I don't know, a training that you've done on fire safety in your workplace.
More interesting than that.
Much more.
Yeah.
But where you might have had an experience with an online course where you kind of do sit there and you click through, or perhaps you're actually just uploading a paper that you've written. We then come, we mark it, we give you back some really great feedback.
Fantastic. Some questions about kind of writing skills and ability. So some people are kind of, it's difficult to say what's good research writing. I'm sure there are some obvious things in there, but what do you expect from students when they start the programme in terms of writing and research writing? How would you build their skills throughout the programme?
Do you want to say something about IELTS first, then I'll say a little bit
Sure.
about the
Yeah, absolutely. So we do require, there are some exemption countries or some categories where if you've won your degree in different countries that you might not actually have to take an English language test. However, we do require that students coming from countries that are not on that exception list do take an English language test. You can see the specific grades that you need to achieve on those on our website. So really do go and look at that. One thing that we do, so because we do require that for you to start the program, we do suggest that you do those, apply early so that you know if you've gotten in and if you would like to explore taking those tests, but B, sign up to the test early, because often the results take a long time to get, and often they don't sit those exams very often. And so if you're running towards the end of August and don't have that in, it's going to be really difficult for you to actually catch up and start our program on time. So I really would like to plug, do this early, think about it, understand whether or not that is a condition of your acceptance before you apply. Yeah.
So I think it's a really, really important and good question to be talking about that sort of academic English. And actually, interestingly, from my experience now on campus for quite a few years, some of the most challenging academic English is actually by native English speakers, and often it's people such as myself or kind of mid-career sort of professional types. It's often the doctors who have the biggest problems with academic English, I've noticed. But that's something that we work with you on, and we have a formative essay at the start of the course because we know that for some of you it will be a bit of a step up. What does good academic English look like? Well, it looks like a paper that would be published in a journal. So that's where we're trying to get you to, but we know that you won't be there at the start of the 2 years. So we work with you on that. There's lots of opportunities to get that feedback. There's lots of formative opportunities as well. And we'll be developing you over the course of the 2 years. But that's a challenge whether you're online or on campus. And it's a learning curve for all of us. And as someone, I publish research, I have to admit, I still can improve my writing, and occasionally, and very irritating, I get picked out at peer review for a particular syntactical error, and I get upset by that. So absolutely, we can all improve.
Absolutely, we all do. And I think one of the beauties of this program as well is that you'll learn how to write in a very academic style, a journal article style, but you'll also learn how to write a brief, because a minister doesn't really want to read your journal article, unfortunately, or fortunately for us. One or the other, I'm not quite sure. It's a bit unclear. But you'll learn how to write in many different styles. But what we do ask of all of our students is that you do kind of think about plagiarism, citing, and all of those things. So there is a standard, even if the mode of writing, as it were, to the audience that you're trying to pitch this to is a bit different. But we do work with you all along the way.
Right. Thank you. Well, I think we've probably got time for one or two more questions. A popular question is about, when students finish this program, what are the opportunities? What are the careers? So could you talk a bit more? It's quite a broad range of careers, no doubt. Yeah. So if someone's looking for a career in public health, what could this degree help? How could it help them move towards that?
So it's a really, really diverse jobs market out there post MPH, and that can be sometimes daunting for those of you who are doctors and you have this idea that certainly in this country there's sort of this conveyor belt that you just move on to, and you start as an intern and then you sort of proceed. But the exciting part about public health is that you can go into so many different areas. I would say for our graduates, I'd say that a lot of them will be going off into you can think about, I suppose, those people who go off into academic practice versus and sort of PhDs, and those people who go off into stuff that is non-academic. I'd say that there's certainly more people going off into the non-academic stuff than the PhD here. In terms of those other sort of then employers, you've certainly got government, which would be a really, really big one. And whether that you're thinking of sort of global government, United Nations, WHO, that's sort of one area. Certainly, national governments are a very big employer of public health people. Here we have Public Health England, there's CDC, there's state departments of public health in the United States, and wherever you are in the world, you will likely have your own government public health organisation, as well as further local organisations and regional organisations. So in the public sector, there's a lot of opportunities, and an MPH is really what I would be looking for. I work 1 day a week in local government in London, and an MPH is what I would be looking for as my minimum entry standard, really, for a public health new entrant. There's also opportunities in the NGO sector, and a lot of our colleagues go off there, and whether that's going into Bill and Melinda Gates Foundation or other NGO type organisations, that's another avenue. And we also do have people who go off back into the pharmaceutical sector and into private sector organisations, and increasingly with the sort of pressures we have on health system management nowadays, issues around population health management, health systems development, those are actually very competitive areas that we simply cannot staff. So there's a lot of interest from the consulting groups actually in trying to pick people up who have genuine expertise in these areas.
Absolutely, and I think it's that foundational background. So maybe you are a pharmacist, and what you're thinking about in the job that you're in now is actually, we're really thinking about what drugs do we want to start to research, and that does, part of that is thinking about the core foundation kind of concepts in public health about what a health system might pick up, what the WHO, how are they going to think about an essential medical list. All of those factors, which really are things that you learn on this course, and then you can apply to even a more technical area like pharmacy.
The other question that we sometimes get asked at this stage in these sorts of careers sessions that I do elsewhere is, what's the difference between public health and epidemiology? And I'd say just very comfortably and confidently, the MPH degree it's a practical degree about being competent in public health. Epidemiology is part of public health, it's our language of public health. But this, you're going to cover certainly the basics of epidemiology and biostatistics. But an epidemiology degree takes you in probably on either more academic or much more quantitative statistical direction. This is very much around those broader skills, and having someone that they've got an MPH, I can employ them because I know they're going to be able to do this, and this.
Absolutely, and it doesn't mean that you couldn't get a job as an epidemiologist, but we're not focusing only on epidemiology. So absolutely, I would agree with that.
We'll probably have one last question,
Great.
if that's okay, because we have scheduled this to finish pretty much now. But I think there's a couple of questions just about the research portfolio and the kind of the dissertation or the traditional on-campus thesis at the end of the programme, and a query about that. It looks as though that's only 4 months to do that in. However, that's not the case.
Yeah. So the way that we've designed this is, I think, particularly important for folks who are on an online degree. We really want to walk you through all of the phases of the research process. So actually, right here in term 3, you're already starting to do everything for your project. So you're designing your research question, you're writing your background, and you're writing your literature review. Obviously, when you get to stage 4 to actually write up that paper, you're going to go back over this. You're going to change it probably quite a lot, but you already have that foundation there. In term 2, then what you do is you learn about research methods as a whole, qualitative, quantitative, and mixed. But then again, the same thing, you're focusing back on your own project. What methods do you want to use? What makes the most sense? How are you going to design your own project? And the output in this one is your protocol. In 3, we're talking really more about the core skills. What does it look like for a funder? How do you get funding? How do you apply? What is ethics? So in this one, practically, you're going to put in your ethics proposal if you need that. But you're really thinking about how is research running. And in this time, and then in 4, you'll also have some master classes to help you beef up the skills around quantitative or qualitative, if that's what you're going to do, in terms of maybe a meta-analysis. How do you actually conduct that in practice? Then what you have is, and you can really start, once you've got kind of the ethical approval, as it were, you can start working on things. But what we really want is in this final phase, this final term, you have the opportunity to carry out that research. You've got some really devoted time to that. So instead of having to take all these other courses, all you get to do with us is really focus on that paper. And the final output is a bit different than an on-campus. We've got a research, so both of them are research papers. But one of them is a journal style paper and one is a more policy oriented paper. You might be tackling something and thinking about what are the actual implications there versus writing an actual journal or specific journal article.
Yeah. And I've been supervising the on-campus projects now for quite a few years, and I'd say I think this actually does look like a slightly more structured way of doing it. So I'm actually really positive, I think, about how we're scaffolding this and progressing it. One of the challenges we actually have on campus is, I mean, we have, I think, 3 months? Yeah. About 3 months. And actually that it's better to stretch this over a longer period of time because certain parts of this take longer. So actually I think this is a stronger structure.
Yeah, so absolutely. Right when you go into that final term, you should be really set up to succeed and actually just carry out that bit of research rather than doing all of the rest of it, which is also really time consuming. And then obviously putting it all together, pulling it into a final project, as it were.
Wonderful. Well, thank you both very much. And thank you to all of you that have attended today and for all of your fantastic questions. And again, apologies we couldn't answer every individual question, but as we've mentioned in the chat function, we will follow up with an FAQs. There is already quite a lot of information available on the web page, so we do encourage you to have a look on both the Imperial College Global Master of Public Health page and also the Coursera Global Master of Public Health webpage as well. If you have any specific queries about your individual qualifications or your individual backgrounds or experience, we encourage you to email the GMPH-queries@imperial.ac.uk, because whilst we can't answer those individual nuanced questions today, we're very happy to get back to you, and we'll try and follow up over email. So thank you very much.
Absolutely. Thank you all so very much.
And we look forward to seeing you.
Absolutely, yeah. Reviewing all of your applications. It's a really exciting process. It's a really exciting time for us to see what the new cohort is going to bring, and we look forward to reviewing your applications.
Wonderful. Thank you. Bye now.